Are you planning to settle in the capital of west coast of Karnataka? If so, here is a ready-to-build property adjacent to Mangaluru city amidst lush green, which indeed is the right place to have a happy home. Just 20 minutes at a distance of 10 kilometers from the heart of the city, located at near Marga, is one of the most prominent developing area of Mangaluru city limits. A peace and serene place, surely be loved by your dear ones. Surrounded by natural trees and valleys, the 13 cents plot of solid terrain is the destination for construction of your everlasting dream home. Various educational institutions, hospitals, malls, historical and religious places at close vicinity will be additional booster for your comfortable and holistic lifestyle. The ready-to-sale plot, located near Manipal University's proposed campus, will assure you good ROI if you are thinking in terms of investment. Contact +9181 971 43675 or 8217 729859.
Hello everyone, we are back with another episode of Walk the Special Path. I'm Meena Noronha, and today we are going to address a very important topic, dental hygiene in special needs children and adults. Today we have a very esteemed guest, Dr. Sharan Sargod, who has earned his MDS degree from Rajiv Gandhi University in Health Sciences in 2002. Since then, he is actively involved in teaching and research at Yenepoya Dental College, Bangalore, and currently heading the Department of Pediatric and Preventive Dentistry. He is also the Director of Natural Facial Growth Guidance Center in Mangalore, a practicing clinician with special interest in the field of special care dentistry, dental traumatology and preventive dentistry. He is the first recipient of Young Pedodontist Award and has been guest speaker at various national conferences and meetings. Welcome, Dr. Sharan.
Pleasure.
And thank you for joining us today. I think nowadays with the special needs children, dental health is a very important factor. Many of the children with special needs have dental issues and they don't know how to cope up with that. The parents or the children or the young adults, when they have dental issues, when it comes to normal children only it's difficult, but when it's special children have it, I think it's more difficult. So doctor, I would like to ask, what is the importance of oral health in children with special needs?
Thank you very much. We must understand one important thing, that is, oral health is the gateway for general health. Therefore, maintaining a good oral hygiene and oral health is prime importance, especially in case of specially able children or children with disabilities. For two reasons. One, we consider them as people who are predisposed to dental issues, depending on their severity of disability or limitations what they have. They might have limitations in performing day-to-day activities or life activities, what it is called, which is same thing. They might have issues with maintaining oral hygiene or maintaining personal hygiene, which will predispose such individuals to have more dental problems compared to general population. However, it all depends on the type of limitation or the disability which the patient is suffering from.
Thank you, doctor, for letting us know, because I think many special parents out there would want to know. So doctor, what are the common dental issues in special needs children or young adults with special needs?
First of all, as I mentioned earlier, they may have limitations to maintain oral hygiene.
Okay.
So improper maintenance of oral hygiene can cause other issues associated with that, like increased incidences of dental decay or cavities. Patients will have gum problems because they are not able to maintain proper hygiene. Thirdly, many of these children may be on some medications which can have some side effects manifested in the oral cavity, or also they might be having some deleterious habits like clenching teeth, grinding teeth, etc., which is damaging to the oral cavity. So some of the damaging oral habits they might be indulging in or doing it. Apart from this, most of these children may have self-injurious habits. They like to poke something, clench on something. I had a patient who had extracted his own teeth, or I also have seen individuals who are having a habit of shaking their teeth and things like that. So these are the common issues which generally individuals with special healthcare needs suffer from. However, it is proportionate to the type of disability he is having.
As you mentioned, medicines also affect dental hygiene, doctor?
I would say dental health. Some of the antipsychotic medications or anti-epileptic medications can cause some changes in the gum health. Gums can get enlarged, or some medications can cause dryness of the mouth, which will predispose such individuals to other dental issues and problems.
I think parents out there need to have a lookout for all these symptoms in your child if they are taking continuous medicines. So doctor, what more dental problems are seen, I think, in children with autism? Mainly non-verbal children with autism. So what are the barriers to dental health in these autism children?
If you take general fact that there is no difference in the oral health condition of an autistic child compared to general population. However, as I mentioned, even in autism there is a spectrum. So individuals who have mild spectrum may not have so much of issues. Individuals with great difficulties in communications and things like that, where maintenance of hygiene becomes an issue, they can be predisposed to such dental problems. The main barriers here is because of their intellectual disability, inability to communicate, inability to express what they are feeling, where the pain is, whether it is hurting, whether any problem is there, is very challenging. That is the reason such individuals will have more such issues. Apart from this, these barriers could be from the parental section as well. Lack of awareness of the parents on maintenance of hygiene because of their own reasons. There are many challenges to address other than oral health according to them. So that also becomes a sort of a barrier. Next barrier could be accessibility to dental care. Many a times you may not be accessible to dental care depending on the prevailing condition. If the clinic is in 5th floor, 6th floor, it's difficult to take them, carry them, reaching the wheelchair, and these are common barriers from dentist point of view. Otherwise, majority of the barriers are from the patient's aspect and parental aspect, which is directly or indirectly related to the condition which the patient is suffering from.
Okay, doctor. Doctor, how you think a parent should choose a dentist? Because sometimes a child is scared, or sometimes a parent hesitate to go to dentist seeking, okay, how will my child respond to lights, to the atmosphere there? So how you think a special parent should make a decision to choose one's dentist, and how does a dentist will handle such differently abled ones?
See, first of all, you should assess which are the dentists in your area is accommodating special children. Accommodating not only I mean by accepting to treat such patients, also in terms of accessibility, wheelchair accessibility and things like that. Generally, you should go to a dentist who's trained in handling special care dentistry patients. Normally in our country, the pediatric dentist or pedodontist, whom we call as, is specialized in handling special healthcare needs children beyond the age limit. Otherwise, generally a pediatric dentist handles patients up to say 14 or up to 16, 17 years. But children with special healthcare needs or even adolescents with special healthcare needs can be managed easily by a pediatric dentist because he is trained to handle such patients. Apart from that, there are many situations or many courses available. Any dentist who's done these courses on handling special healthcare needs can be chosen. But most importantly, as you asked the following question, that how will a dentist handle such patients?
Yes.
Through the training process, they'll have their own ways to handle such patients. But to sum up and say, he will have empathy, compassion, and patience to handle such patients. That is what is most important in any dentist or healthcare professional handling special healthcare needs.
So I think compassion and patience are the important virtues
True.
when it comes. Yes,
True.
doctor. Thank you. And I think to the viewers, especially as parents as such, if you have an adult child also with special needs, you can go to a pedodontist. I think that's what you
Pedodontist
said.
or pediatric dentist or simply children's dentist.
Because mainly parents think it's only for the smaller children. But now I think parents, to answer your query, even an adult child with special needs or an adult with the special needs, you can go to such pedodontist or pediatric dentist when you have a dental issue. I think that's correct, doctor?
Correct. Simply they are trained to handle such patients.
And doctor, how often should a special needs child or a young adult should be seen by a dentist? Should they go regularly or once in a while? How often, with a problem, without a problem, or how many times should we go?
As I mentioned earlier, that all these children are predisposed to dental problems, meaning they can have more dental problems compared to normal population. So depending on the type of disability they are having, the dentist will decide the recall schedule. You have to visit once in 6 months, once in 3 months, once in a year, and things like that, depending on individual patient's needs. But in general, before the first birthday of the patient, he should see a dentist. Ideally, we recommend to see when the first tooth erupts in the oral cavity. However, not later than first birthday of the patient. Then onwards, the doctor will tell you customizing a dental visit for that particular patient depending on individual needs of that patient or the kind of disability and associated medical condition which the patient will be experiencing. Based on that, he is going to schedule it. To tell it in a general context, once in 6 months is must for everybody, generally also, especially for special care needs children, to visit a dentist, because here we must understand that prevention is the key. Most of the dental problems can be absolutely prevented if right attitude, dental attitude we call, right information, right attitude is cultivated by the parents and the individuals. It can be prevented at a very early age, and this preventive process can start at a very early age so that it will continue in the right direction.
Okay. And I think to all the parents out there, please do take your special needs children, young adults to a dentist regularly. You will find out so many friendly, there are many friendly dentists out there. Please do take your child for a regular dental checkup.
At the premium gateway to Mangaluru, one of the premier cities of Karnataka possessing all types of domestic and international connectivity, is a full-fledged commercial complex, the Premier Corner, Nandur, now available to make your dream venture a reality. Each floor is spread across 4,200 square feet to provide a class ambience to your clientele. Adhering to all safety norms, the Premier Corner is all set to be a game changer for any business, thanks to its easy connectivity. Located right beside NH66, Premier Corner has been built in view of futuristic needs with ample space for vehicle parking in 2 basements. The G+3 story building is the right place to start premier ventures like corporate office, vehicle showroom, IT firms, exclusive retail shops, brand outlets, and to add on, a terrace cafe. Come, invest and own this premier space at Premier Corner. Contact +91 81 971 43675 or +917676218101 for a premier business deal.
So, doctor, can you give us some tips to maintain oral health, especially in special needs children, those who are non-verbal, they are not able to communicate if they are having pain. So, what tips would you give to maintain this oral health, oral hygiene?
First and foremost is we should understand that oral hygiene, like any other personal hygiene, should be given equal importance, because as I mentioned, oral cavity is the gateway for general health. So, general tips if I have to give, maintenance of oral hygiene through brushing or physically removing the plaque and debris or food remnants from the tooth is the key.
Okay.
Now, depending on what the disability the patient is having, for some they might be able to do it by themselves, some they might be requiring assistance, for some they may not be able to perform their hygiene. Somebody else, parent or the caregiver, will be performing the oral hygiene aids. So, depending on what individual needs, you can plan. In general, toothpaste and brush, cleaning the teeth regularly, that to 2 times a day, is very normal and recommended. Individuals who can't maintain oral hygiene by themselves, a caretaker or a parent is doing it, then there are many toothbrushes, there are many toothbrushing techniques. If you visit a dentist, he is going to teach you how to brush a patient who can't do it by himself.
Okay.
So, we are going to guide them that this is how you need to brush. There are some conditions where the patient may not be able to spit out. So, in those conditions also there is a particular position in which the patient should be made to lie and the caretaker can clean. So, basically you have to scrub everything from the teeth and remove the debris, plaque or food particles from the teeth. But children who are having disability and can't maintain by themselves, not 2 times as I told you, after every meal they have to clean their teeth to prevent any food from sitting on the teeth. That is the most important thing what we have to follow.
Okay, doctor. I think especially those children who eat a lot of junk food or chocolates, I think this brushing is very, very important, as you are saying, doctor.
Correct, very important.
So, doctor, parents with special needs children, they always hesitate because they are scared how the child will react, how he'll face the dentist, or about the atmosphere there, or how much empathy the dentist will show. So, how can parents make their dental visits with their special ones successful?
See, very important, good and relevant question you asked. First and foremost, you should meet the dentist beforehand, or choose it. Once you have chosen a dentist, you have to go and meet him in person or make a call and ask whether you can accommodate such child. This is the disability. These are the likes and dislikes of this patient. Some autistic children have strict routines which they don't want to deviate from. So, can you accommodate them in such a situation? So, likes, dislikes, their abilities, all these things should be told or explained to the patient in hand, which will be helpful for the dentist to schedule his appointment accordingly. Suppose an autistic child doesn't like to go in a crowded reception area, then dentist may make provision to come first patient early in the morning or during the lunch break or at the end of the of his practice, so as to accommodate him. Many of them are scared of certain light or sometimes abnormal stimulations. They are over-responsive, hyperactive, which the dentist may not like to be disturbed, or the other patients may not be like to be disturbed. So, he will make provision and accommodate such patients into his environment. Also, what are the other things that individual patient might require, like whether a wheelchair access is there, whether he can accommodate and transfer the wheelchair for a patient from chair to the transfer, or is it a need to be treated only on the chair? And these are the things you need to have a discussion with the dentist. This goes very slowly, step by step. Don't expect every patient as soon as you enter the clinic, get it treated and come. So, it will be a step-by-step process. First step is introduction, second step is familiarizing the environment, third step is trying small procedures like examination, things like that. And later you can do advanced treatments and things like that. So it's a slow step-by-step process, but both the dentist and the parent will have hand-in-hand association, and they are a party to deal with this patient.
But I think many of the dentists may not be trained to deal with special needs children, I think.
Correct. So you should choose dentists who can, as I mentioned earlier, can accommodate such patients, and he is trained in handling such patients.
We need to do a research as parents, which dentist will accommodate the child, because especially when there are long list of waiting, and the child cannot wait. So I think can have a discussion to have a little priority basis.
And most of the clinics give priority for such a, provided you in advance you make an appointment or have a discussion with the dentist or the treating physician or anybody like that.
Okay, thank you so much for this knowledge, doctor.
Attention! Here are two properties located just adjacent to NH 73 at Melkar BC Road, which is the place most appropriate to realize the dream of having the home for a happy living. Just 30-kilometer drive from Mangaluru, the west coast capital of Karnataka, two layouts of 20 cents and 19 cents respectively, with village ambience, are ready to build with clear documents. The hill opposite to these properties are reserved for the proposed university campus of a prestigious Mangalore-based institution, giving you indeed the right investment opportunities in future. Pious religious centers around will give you a spiritual feel amid modern lifestyle. On-time healthcare facilities and educational opportunities are available within reach. Contact 91-81971-43675 or 821-77-29859.
Doctor, I think many parents may not be able to use brushes or something. So there might be different oral hygiene aids. Can you throw some light on this, doctor, on special oral hygiene aids?
See, again depends on the type of disability. Normally, a regular toothpaste and brush is good enough. But since I told they are on a risk of developing caries, so we generally recommend high fluoride containing toothpaste for patients with special healthcare needs, simply because they are predisposed to decay or gum problem. Secondly, try to use soft brush which is comfortable for the patient. We have a wrong idea that you have hard brush and brush forcefully, it will become more cleaner.
Correct, doctor. I think
you might hurt and make the brushing experience very uncomfortable for the patient.
True.
So have a soft brush with fluoride containing toothpaste. Sometimes the fluoride content might be more, or the paste could include some medications depending on the needs of the patient. We might also prescribe some antiseptic mouthwashes or rinses to keep the gum health. In some situation where the patient may not be able to brush properly, like in cerebral palsy patient or in individuals who can't do personal hygiene by themselves, a good way to use is to use a motorized brush or battery operated motorized brush, which is something fancy. Some children like it to play with that also, and it rotates basically. So helpful for caregiver to reach out to the areas which are not accessible, can be used. It will be with a smaller head, and we can modify a lot of this oral hygiene depending on the oral hygiene aids, depending on the needs of individual patient. For example, if somebody can't hold a regular toothbrush, we can increase the thickness by putting some pad, some handles we can fix to that, so that he will be able to, in a spastic child, he will be able to brush it well.
Okay.
So you can increase the grip of the handles by incorporating or modifying, custom designing some things with addition of pads and some rubber tubings onto it to facilitate the manual dexterity of the individuals. Those also can be done. But the bottom line here is you just have to physically remove the debris and plaque from the teeth. That is it. Also, we have multi-headed toothbrushes, meaning that there will be a tooth bristles on all the sides of the brush. not only on the upper part, sides also. So this in one stroke cleans the grinding surface of the teeth, sides of the teeth, back of the teeth in one stroke. This is also a good device, or multi-headed toothbrushes, which will be helpful in cleaning for patients who are not able to maintain their hygiene by themselves.
Okay.
It's easy for parent, or patients who are having issues with the manual dexterity. Those patients also can use such
I think
kind
nowadays
of toothbrush.
toothpaste are coming in so many different flavors, so they can choose as per the child.
that. And as you know, most of these, especially autistic children, they have their own reactions to the smell, taste.
Right.
They may like certain taste, may not like certain consistency and things like that. They have a rigid routine and unusual responses to stimuli and things like that. So see what he likes, how he likes, and things like that. Depending on that, you can choose. But it's always good idea to consult a dentist before using any of these hygiene aids.
And here I would like to ask you, doctor, most of the children have these mouth ulcers, or gums, or on the tongue, or inside the mouth cavity. Is it anything to do with dental hygiene or deficiencies?
Not always related to dental hygiene. Most of the time it is due to a systemic manifestation. So could be due to any medication. Suppose he has had an illness and he has taken antibiotics, then there are chances he'll get. Or some nutritional deficiencies, or simply stress also can cause ulcers in the mouth. And this is more so commonly found in children with autism or children with special healthcare needs, because of prevailing systemic condition, which could be nutritional needs, which could be due to some drugs, or simply stress also can cause ulcers in the patient.
Doctor, what advice would you give about dental hygiene to these parents who have special needs children or non-verbal children, or even with the young adults who are struggling with life? What advice would you give to these parents?
See, first of all, as I mentioned, establish a dental home. This concept is there in foreign countries, that basically nothing but you contact one dentist for all his dental needs. That dentist may tell you to go to another specialist who is specialized in surgical procedures, or gum specialist, or anybody. So establish one dental home first, or contact one point for all dental needs. Maybe a specialist need to look at his gums or things like that. Secondly, you consult the dentist to maintain a good oral hygiene. Maintenance of hygiene is a key here. So consult him depending on the needs of the individual patient. The dentist is going to design a recall visit or a hygiene practice aids. He'll give you some directions and the instructions on how to maintain. But if I have to say specifically for autistic children or children with intellectual disabilities, learning disabilities, it is good idea to train them from the beginning itself. You can use various means of, most of these children learn by imitation, learn by looking at the screens and things like that. So you can take it to your advantage. You can also use picture exchange communication system. You can use visual pedagogy to train such individuals from the beginning itself to cultivate a dental hygiene practice.
Okay.
And most importantly here is that you have to consult a dentist on what he requires, what are his needs and challenges. Then he is going to advise you on right track. It is always a good idea, if you find it difficult to make the child brush the teeth or develop the habit of brushing, it is good idea to ask your behavior therapist or your speech therapist, or simply make it as a curriculum in the special school which the child is attending.
Okay.
So there they have their own skills to make these children practice this in the school, and that can become a good habit at home also.
Okay, thank you, doctor. And doctor, as you are part of the dentistry board, you mentioned, how much of this awareness about dental hygiene is going on in Mangalore? Because right now our aim is to make Mangalore an inclusive community. So how much of dental hygiene awareness is going on in Mangalore?
There are a lot of boards and what we call it as societies to cater to the special healthcare needs individual. To mention one in our country is Federation of Special Care Dentistry, FICD. This objective of this society is to promote oral hygiene, oral health among special care needs children. Now coming to specifically to Mangalore, we have many dental colleges which seriously practice special care dentistry. Like I practice in Yenepoya University, so Yenepoya Dental College, you have ABCT, KMC, AJ. All these institutions have accessibility and the facilities to treat such patients. Apart from this, my institution also has a satellite center in Wenlock, in District Early Intervention Center, which is catering to children with special health care needs, that too totally free of cost for individuals with either physical disabilities, emotional disability, intellectual disabilities, or patients having syndromes. All these patients have been treated. So anybody who wants to avail such services can visit District Early Intervention Center in Wenlock Hospital and avail these services.
Okay.
Also there are many private practitioners who are practicing and treating or accommodating special healthcare needs patients who are providing services.
Thank you, doctor, for so much information. I think special parents out there, many of your queries are answered. Please practice good dental hygiene. And as told, we have got so many tips from today's guest, Dr. Sharan, who is there today with us. Thank you so much, doctor. And before we conclude, I would like to ask you, doctor, if you would like to leave a note for News Karnataka, what would that be?
First of all, I must congratulate the News Karnataka news channel and Madam Meena for taking up this small issue which can have significant impact on the health of children with special health care needs. I am sure the information which we have shared here through this channel would benefit many of them watching this episode. And I'm glad that, as Madam mentioned, that our intention is to create awareness about oral health, special healthcare needs individuals by forming self-help groups and spreading awareness and information through such hosting such host. I must really congratulate and appreciate your efforts to do such a wonderful job. So what I would like to leave or conclude here is that each special health care needs children is different. They have their own challenges and needs. So the oral health care process or maintenance of oral hygiene might go very slowly initially, but with determination and with efforts, you can have best or positive outcomes and results out of it. So have patience and get rightly informed so that you practice what is essential for that particular individual.
Thank you very much, Dr. Sharan, for enlightening us today. And I hope everybody has liked this episode. If you have any queries, please do write to us at News Karnataka. And we conclude this today's Walk the Special Path, Dental Hygiene in Special Needs Children. Thank you, everyone.
Thank you.